Thank you. So my title is not about my research, and what I will tell you is not about my research. So when I got the email from Ahmed and Schnell, I did not reply. I got an email back, are you not interested in the NeHub? And I said, yes, but I'm on sabbatical. So yeah, I'm a big fan of sabbaticals, which I did 2 years ago. But then we met back online, and the reason was actually some of the activities that we were doing in the context of IC Health. And that has been my pet project the last 2 years, because I really like being in a role where I can facilitate collaboration between researchers within KU Leuven. And it's about creating an ecosystem for in silico researchers within our own university. So I want to take this as a way of telling you how we approach building that ecosystem within KU Leuven and what we have learned and how we have focused on certain things and left out other things. So I hope you can see some of the analogs with what you are trying to do. So we at the university had the opportunity to work towards institutes that were multidisciplinary, that were also crossing different boundaries within the university. So typically we have engineering, you have biomedical science, and you have societal science. And this was a way of collaborating and finding researchers who were working on similar things, but who are located in different places in the university. So what I show is definitely not only my work, but it's the work of a whole team. And when I say team, we are at the moment with 69 professors who are all doing in silico medicine within KU Leuven, and they are broadly distributed in KU Leuven. So these are all people who believe in using computer models. They are in different research groups, but the methodology of using the computational models is what kind of unites them. And they're all really wanting to not really push, but they would like to see their methods being used in clinics and also are willing to reach out to industry. So what we decided to do is to take advantage of the diversity of the group to leverage our institute and try to find parallels that we can use between different organ systems. So we have people who are using different kind of models. I made a list, like we have people using FA rigid body models, people using agent-based model, gene regulatory network models, and PBK models. So really the technology here is not really the central theme within our institute. We have people looking at different systems. So we have cardiovascular, MSK, brain, cancer, and drugs. So it's really a broad community that we try to unite. And of course, the main message is in silico medicine is the push of the future. We should now jump on this train, and we should try to unite and also kind of streamline our processes. And I think here you hear already a bit of an analog with what this community is trying to do in order to have reduction of developmental cost of new treatments, and by that way also have a better prediction of our intervention outcomes. So we are trying to give or create visibility for our community, like the Open NeHub is trying to do. We found that by giving the network visibility, we could create some group feeling, and also this allowed us to find the clinical actors who are interested in computational models, and it could open, or it did open some doors within our university hospitals. And also what we feel is that industry has now found an access port for approaching researchers within our university and within the hospital. So we started with making a list of aims, and I think these aims are similar to what NeHub is doing. So we want to be a central network hub We also decided to work towards the adoption of good simulation practices, and this already starting from the undergraduate level of the people in our research community. And I will show you some examples of how we are doing it. We also have invested quite a lot and are still investing in developing educational programs. We are a university, and the whole push towards upskilling and reskilling of the healthcare staff of the future is really what we use as a leverage to kind of bring our effort more into the public. We also decided, because we are a very comprehensive university, to include activities related to legal aspects, societal and ethical aspects, because we don't want to have our researchers just being model builders. They need to be aware of the ecosystem, and they need to understand that after their PhD, it may well be that they will be within the ecosystem of the computational medicine world, but they need to be prepared for that and also realize that there are some obligations in order to function there. So as in terms of a network hub, we invested in creating a repository for the members. So our members can actually navigate throughout KU Leuven in terms of organ system expertise software. So that created really links. They also have access to description of the project that other people are working on. And we have one central contact person, our institute manager, who makes those liaisons. So if a company would come, we can dedicate or we can signal them to the right PI. We do quite a lot of networking events. They are typically preceded by a thematic seminar. I will give some examples. And then we also started doing targeted grant writing assistance, because if you write a grant related to in silico medicine approaches, there are some common features that benefit our researchers independent of which organ system they are using. For instance, in terms of impact, that is something that is really important. You can say, okay, and what about research? Well, we decided to leave out the whole organ system as a research line. We did look at model development, model validation, regulatory pathways, clinical valorization, and education. We're not setting up specific research projects, but we are trying to gather the information of the individual PIs, but we bring them together at certain thematic seminars so they can share it to our community. And then the bench to bedside trajectory, that is of course where we bring in the organ system. So we have a specific line on MSK research where we really try to push some clinical killer applications as we identify them to the clinics. So some examples. So you see, we talk a lot to each other, and I think that is very good. We have been talking about hybrid modeling, computational reproducibility was one of the topics. We also worked on uncertainty quantification. So you see, there is a lot of bringing together the knowledge that may not exist in one single research group, but that is existent within the university. We also leverage on some EU projects that are currently ongoing to establish the virtual digital twin initiative. And also we liaise with the public. I know that you see your clinicians as an end user. It's not, sorry. If we can convince the public that they can have a benefit of using our computational models, that is what will also push the interest within in silico medicine. And that is something that also requires us to speak different languages, also with societal researchers. You saw already some publication on good simulation practices. Well, we decided to follow the one that was written by or edited by Marco Ficciconti as part of the In Silico World project, which was a big European project in which they laid out some standards for simulation practice. So how do we use it? Well, we have a session on credibility assessment for PhD students where we provide them with a template for their own research project, and we kind of guide them in filling it out for their research project, and we give on the side an example for a cardiac application. But every student who comes to our workshop is obliged to go through this. There have been, so as I said, thematic seminars on reproducibility and uncertainty quantification, because there are a lot of researchers who don't have the engineering background, but they do want to use the computational models, and you need to introduce them into these aspects. We're also thinking of having standardized notebook keeping and try to bring that into the community. Also, the data management plan, which we already have at the university level, we are trying to make that more specific for in silico approaches, and we're also working with the ethical committee at KU Leuven, so they understand that with a valorized model, you can have n equals 1 in a study, because that will save quite some discussions with them. Then about education, we are in a position where we had some additional money coming from the university, and this is actually the initiative where Ahmed reached out. We did an online modeling challenge, and this modeling challenge was to bring together graduate students who could work together on an in silico modeling application. And they could reach out to clinicians, they could reach out to capital investors, and they were working on that, and they were able to see how they can bring their research idea really into an application for the real world. So in the end, we had 2 knee related projects. We had one cardiac project, and the other one was PBK modeling. And the students really enjoyed this. So I think this is an example where we try to bring together young researchers, and we don't only relate to MSK modeling, but we try to leverage diversity here. And one of the other examples is that we had funding from Marie Curie, where we can now work together on a European-wide network of computational modelers in different organ systems. But the nice thing is that we are using it to also create a postgraduate program that we would like to be a standalone program in the future for computational modelers. And here we are now running in the summer school a first trial. And here again, we put emphasis on letting our students understand the whole ecosystem, because we think that that is very important. So it's not about just the computational modeling, which is one of the aspects, but we try to broaden it up to them. Of course, again, uncertainty quantification and credibility assessment is one of the aspects here. We also invest in future career trajectories for them to also give them a perspective to the future. So in our conference that we are organizing in Leuven, all very welcome to come. Also, these aspects are really embedded in the project. So it's about in silico modeling, but it also is how do we communicate it to the community? How do we interact with industrial actors? What do they need from the modeling community in order to be interested, for instance, in computational modeling? We also talk to the challenges to go into valorization, and we also talk about the legal framework there. So I think it's broader than just the computational methods that we have seen here. So to wrap it up, I think my suggestions would be to liaise wisely with sister organizations. Don't reinvent the wheel. I think there are different aspects in what you try to do. So there is the methodological aspect, probably ASB, ESB, ISB are the best frameworks there. But you also need to make sure that your clinical sister organization, industrial partners, I would suggest that also patients are brought in the network. And one thing that I really think is important is that the in silico medicine community, which exists within the VPH community, could really be helpful there. So a true stakeholder mapping, and I've seen that in your scheme, is really what should be done. If I say do not reinvent the wheel, be a portal. I think give it visibility, and I like what Luca has been setting up, and it can be discovered. So people really are looking for collected information. We also see it with our repository within KU Leuven. It's very well used. At some point, I was talking with people of Materialize, and they said, why don't you have a dedicated chatbot that we can just go in and we say, I want to model whatever, can you please give me a contact person? What would be the approach? So there are people looking for that type of information. What we found important is that PIs want to keep ownership and freedom to operate. So I think we can give an invitation to contribute. I'm very much against this is how we wanted to do. Yeah, I would rather give incentives. I'm more for the carrots than for the sticks. I think education of the community is really important. And I think trying to be a seal of excellence, being trained by experts. And I think there to have online sessions, meet the experts, is something that is really something for junior students that can help. And for me personally, and that was more with respect to funding opportunities, I would say think beyond the organ and the model type, because sometimes we are afraid to call ourselves or put ourselves at the level of AI, but you could have data-driven and physics-based driven modeling for knee health. And then you bring in another community, you bring in more complexity, but I think it gives the volume of research, at least what is important in Europe, I don't know how it is in the US, gives it more chances to succeed. And the same for the organ level. So we combine easily heart, brain, and MSK. You need to share the funds, but that's what it is. I made a list of what I have heard, and I think most of these have been said at some point during the discussion. So yeah, I think the only thing that I want to say is that I would also do some broadening seminars and just go a bit away from being the modelers. That is, I think, something that I bring more than what I've heard before. Thank you.